Yes, Diamond. It looks like I'm going to be doing your blood typing test today. And what that means is we're just going to use a kit, which is this one right here. And we will be testing to see what type of blood you have in your amazing body. And then you'll know in case, God forbid, but in the event that you ever need a blood transfusion, or if you're donating, it's just good to know your blood type. So along with the test kit, which will be pretty speedy, it's accurate, reliable, easy, quick, and along with that, I would just like to give you some information on blood types. That's honestly pretty valuable information. A lot of people don't really care, but to know the different groups of blood and who can donate to who and what types of blood you can and can't donate to, just I feel like is valuable information. So for that, I'll just give you a brief rundown, general information. I'm not gonna lecture you and teach you everything there is to know. Nobody wants to do that today. But along with that, I do have a couple of questions from your health history here that I want to ask you. Now, keep in mind, these questions that I'm going to ask you, regardless of how you answer, it's not going to affect your blood type. That's just like set in stone. These questions are just so I can get a little bit of history about any medical conditions, health concerns, anything like that. But I see that you have answered most of it, so there's just a little bit here that I want to ask you. Get that in the system, and then I will go ahead and show you the different types of blood and different groups, and then also just a little bit of information about blood transfusions. Then we will do your little kit and get you sent on your way with the results, okay? Does that sound all right? Okay. Perfect. Do you have any questions for me that you want me to answer before we get started? Or can I go ahead and just ask you some of these health history questions? Ready? Alright. So let me see here. This will be quick, I promise. Okay, we got that. Alright. So as a child, did you ever have any of the following illnesses? Measles, mumps, rubella, chickenpox, or polio? Okay. And let's see. Did you have anemia either in the past or currently? And that's what I'm going to ask you from now on, either past or current, okay? And if not, just say no. Anemia then, no. Anesthetic complications. Asthma. Bleeding disease. Blood clots. Blood transfusions. Heart disease or heart attack. Let's see, hepatitis A, B, or C. HIV. Okay. Okay, looks like we're good on all of these. I'm gonna go down. Do you currently take any medication? Okay, and what is that for? Is that once daily or twice? Okay, do you know the milligrams or no? 25 per dose? Okay. Perfect. And any other medications? Okay, is that a topical or an oral? Topical, perfect. And what area of the body are you using that? Alright. And any other medications prescribed? Just vitamins, no other prescriptions. Alright. almost done with this part. Sorry, I know it's boring. Alright, couple more questions here. Do you exercise? Would you say frequently, often, never? Okay. Are you currently on a diet of any sorts? Okay. Would you rank your salt intake for your food and drink consumption high, medium, or low? Okay. And how about your fat intake, high, medium, or low? Okay. And now for your caffeine consumption, do you consume no caffeine? Do you consume coffee, tea, or soda? Any of those? And how many cups a day would you say? Cups/cans. Okay. Do you drink alcohol? Okay. And do you use any tobacco products? Alright. How about any recreational or street drugs or medication, street pharmacy medication? Okay. Alright. And do you have any history of mental illness? Okay. That is all I need from you for that part. Again, I apologize. I know it's a little bit extensive, but it's good to have that in case we ever need to treat you in the future and we kind of know a little bit of the important details about you. Alright, now let's get into this quickly. Let's talk about blood types and then we will start your test. After we do your test, we will just send you home, like I said, with the results. We don't even need to do anything extra. So we'll give you the results, send you on your way, okay? Alright, my friend, so let's take a look here. We have our different blood types. Let me get one more paper on top, sorry. Put them in the wrong order. Here we go. So this is just a brief rundown of how blood type is determined and why you need to know. And all of this information that I'm about to share with you, as well as the pictures, can all be found on the Red Cross website, in case you want more information. So let's take a look at this. This is our little chart, how blood type is determined, and then our different groups of blood. Group A, Group B, Group AB, and Group O, okay? So let's take a look. Blood types are determined by the presence or absence of certain antigens, which are substances that can trigger an immune response if they are foreign to the body. Since some antigens can trigger a patient's immune system to attack the transfused blood, safe blood transfusions depend on careful blood typing and cross-matching. Do you know what type of blood is safe for you if you need a transfusion? Well, of course we don't. That's why you're here. And that is why we are going to do your kit. Because in the event that you ever need a transfusion, we have to make sure that we match with the proper donor for the recipient being you. So let's look. There are 4 major blood groups determined by the presence or absence of 2 antigens, being A and B, and those are what is present on the surface of the red blood cells. In addition to the A and B antigens, there is a protein called the Rh factor, which can either be present plus or absent negative, creating the 8 most common blood types: A positive, A negative, B positive, B negative, O positive, O negative, and AB positive, AB negative. Okay? So those are the 8 groups. Or I should say, I'm sorry. Those are the 8 types. So let's see. There are more rare blood types, but these are the 8 most common. So let's look at Group A. If we look at this little picture here, Group A has only the A antigen on the red cells at the bottom. See that right there? That's the A antigen, and these are the red cells, and this is the plasma up here, this yellow. So group A has only the A antigen on the red cells and B antibody in the plasma, okay? Group B has only the B antigen in the red blood cells and A antibody in the plasma. So just reversed for those two. And then let's look at the other two. Group AB, which is this. Group AB has both A and B antigens on the red cells, but neither A or B antibody in the plasma. See how the plasma is empty up here? And then group O has neither A nor B antigens on the red cells, but both A and B antibody in the plasma. Okay, so that's how that works. That's a little look at what it structurally looks like. And then blood types and transfusions. There are very specific ways in which blood types must be matched for a safe transfusion, as I was telling you. The right blood transfusion can mean the difference between life and death. Literally, somebody could be unalive because of a bad transfusion or a non-matched transfusion. So let's see. The universal red cell donor has type O negative blood, and the universal plasma donor has type AB blood. So it'll be interesting to see what type you have. And then I just want to show you one more chart here, just to give you a good visual of, depending on your blood type, who you would be able to donate to. I mean, you can donate your blood whenever you want, but I mean what recipient blood type would have to be to get yours. Okay, do you get what I'm saying? So let's look. Here's all of the graphs, and if you can tell, we clicked on O type here, and O can go to all of the following recipients. This half bag means we've selected A, and A can go to only these recipients in the red. Do you see how that's working? I'll make sure you can see it as well. So for a donor, if you have O blood, the following recipients can receive your blood: O, A, B, and AB. If you are type A blood type, the only recipient blood types will have to be A and AB. But remember, group O is the universal donor. So if you have O blood, you can donate to any of the following blood types, any of them. And then if we go down to group B can donate red blood cells to Bs and ABs. Okay, so that's that type of blood. And group AB can donate to all other ABs, but can receive from all others. Okay? Does that make sense? I know it's a little bit confusing, but when you see it visually and you break it down on the chart, you can kind of get a better idea. So yeah, that's the rundown of the blood types and the matches for transfusions. So let's go ahead and start your test so we can get you out of here and we can figure out your blood type. I'm going to put on my gloves and then open the kit. Okay. How are you feeling? You're not nervous or anything, right? It's going to be very, very easy, pretty much painless. You're going to be just fine. Yeah? Okay, good. Okay, I'm going to go ahead and open this and remove the contents of the bag. Okay. We have our lancet, and that is what's going to just break the skin ever so slightly so that we can get just a tiny bit of blood, okay? And let's see, let me lay everything out for us, and I'm going to send you home with this card. This is how you will read your results. These are your results right here. These are all of the possible results and what they mean. So for O, and then it's also testing for the RHD, whether it's positive or negative. So it's very in-depth. It'll tell you everything you need to know. So I will briefly show you everything that we have here. It's just let's see, 1, 2, 3, 4, 5, 6 different things. We have our little lancet. We have some adhesive to put over once we are done. We have an alcohol swab to clean the area. we have these little things, and we have our card to put the blood on. So let's go ahead and begin. I'm going to open this card up right now. Just going to tear that open and bring it out. Alright, so are you ready to begin? We just need to clean off your finger. We'll do the mark, put the blood on the card, add the water, and then I will send you home with the card that tells you your results, as I mentioned that right here. Okay? You ready? Alright, come on, you're gonna do great. So I'm gonna get the alcohol swab open. And what finger would you like to use? Either pointer, middle, pointer on this hand? Sure. I'm gonna clean that off. Really good here. Just make sure it's super, super clean. Alright, give that just a second to air dry. And I will get this lancet ready and the card. And I also have a piece of paper towel here in case you have any remaining blood on your finger. We will wrap this up with it, or wrap it up with this. Drop, drop, drop. Make sure that it's cleaned off. Are you ready for the little pick? Yeah? Alright, now I'm going to go ahead and use the lancet on you to make the tiniest little mark. Do you want to go ahead and just take a breath in? It's not going to hurt bad. Littlest little pick ever, but sometimes it scares people. So go ahead and just take a breath, okay? And breathe out. Here we go. 1, 2, 3. Perfect. And I'm just going to squeeze your finger a little bit here. Get a drop of blood. Now we need to use this little tool here to get droplets of blood to put on the card. So let me go ahead and just squeeze your finger, and I'm going to get the first little droplet here. Perfect. And we're going to put this on anti-A on the card. Alright, and I'm going to squeeze your finger again, get the tiniest little bit. Put that on B. Okay, let me just roll your finger. Sorry, I know it's probably a little sore, but we just have to get 2 more drops. Put that on anti-D. And the last one for the control. Little bit more here. Perfect. And now we just need to use this little thing here to get some water. And we have to put a drop on top of the blood. You see how that's in there? Oops. So let's get some of that, and I'm going to drip this on the card now, and then we just have to wait. 2, 3, 4. Perfect. Let me get you a paper towel for your finger. Go ahead and wrap this around. Just press and hold between your fingers. Good. And we will wait. Let's see, how long do we need to wait? Perfect. It's only going to be about a minute or 2. So I'm going to gently move this card over here, and then I will give you this, because this is going to give you your result. So here you go, and you just follow the chart, and then you'll be able to tell what your blood type is. And other than that, that's all we need to do. Let me see your finger. I'm just going to wipe that off. There you go. Oh good, you stopped bleeding already. Looks like we don't even need a bandage, so I'll just give you this to hold on to. Just keep that wrapped around your finger, and you will be good. Besides that, do you have any questions for me? A little concerned about the results? No worries, I will have one of our techs come in and explain the results to you, okay? Yeah, absolutely. Well, thank you so much. It was a pleasure to meet you, and I hope to see you again, okay? Alright, bye-bye. Have a good day.